It takes about eight years of undergrad and dental school to be a dentist, and takes another 3 years of school to be an orthodontist. And you were asking what's the difference between a general dentist practicing orthodontics and an orthodontist, and that's the difference. 3 years of extra residency versus taking courses here and there to practice orthodontics. And then after that, many hours of continuing education courses. Almost every month I'm going to a continuing education course. And that's what it takes to be able to stay on top of technology and treat our patients right. We're not just making the teeth straight, we're in fact redesigning the faces. And that's why it's so important that we see patients when they're young. And the American Association of Orthodontists recommends seeing patients at age 7. Sometimes we even see patients younger, just because there are certain changes we can do to the face that we cannot do beyond a certain age.
Here at their first exam, it's just checking to see if treatment is needed. Sometimes treatment is not needed, and we'll just continue to watch them. And that's why it's so important to get them in so young, just in case they do need treatment. The kids are usually excited. With Dr. Farrah, she offers all different kinds of brackets. And then with the adults a little more hesitant, don't, want it to show. So we have, again, like I said, different options for the brackets.
Of course, you can do metal braces. For adults, we do a lot of clear braces. There are ceramic, there are static braces. However, they sit, outside of the teeth. There is Invisalign, which in some cases it works well, but patient selection is important. And then there is eye braces or lingual braces, which is we put the brackets inside the teeth, on the other side of the teeth.
Don't be nervous. Be excited. Be happy. But it's always about taking that initial step. When they come into the office, I give them a tour of the office, do the x-rays, what we call the initial records. We do a series of x-rays and photos. I bring them into we have 2 exam rooms, and I'll sit down, have a conversation with the parents and the child, just ask them their concerns, their questions, see how they heard about Dr. Farrah, if they were referred from one of our patients or referring dentists, and their concerns, if it's financially, timing, what they heard, and get them kind of prepared and go over their options. And then when Dr. Farrah comes in, she does a full, complete exam. And afterwards, I just kind of go in a little more depth, explaining everything and seeing how they feel about it, all the payment options, and then get them started.
My mission in this life is to make a difference. Every patient that comes through the door, I look at them as my own children, or my sister, my brother, and I treat them as if they're my family, and they are my family. They are my extended family.
This is our family. All the girls that work here with Dr. Farrah, all our patients, parents, grandparents, it's a family. Like, I'm getting goosebumps talking about it. But it's exciting that we see a new patient and they start with us, and we continue to see them, and we continue to see the process throughout the treatment. But we want them to feel loved, and that we're open and we care for them and their families. And that's extremely important to Dr. Farrah and all of us girls.
I get many letters and emails every day from patients that how this office is so unique in, as they come in, they just feel the warmth and the love. And that's how I'd like my office to be. And my staff, they're wonderful. we're all, my staff, my patients, we're all a big family.